Have you ever felt like you are getting a little confused when you're applying for these jobs as to what exactly is a care worker, what is a support worker, what is a senior carer? Have you ever come across that confusion? Have you? If you have, stay tuned so I'll tell you more about it in the next bit of the video. So I must just say a big shout out to Njabulo that actually made the releasing of this video much quicker. A quick big shout out to you, Njabulo. Whilst I was planning to do this video, you gave me such compelling reasons to come out with it much sooner than I was expecting. It was going to come out anyways for everybody, and just to say thank you for prompting me and getting me to do it sooner, and good luck to everybody that's looking. Stay tuned on the cusp with Daphne as I bring you more of all the differences between the different categories of work. Stay tuned.
No one can do it like you.
So what I'm loving so much about you viewers, about you subscribers, about you viewers of this channel is that you are actually seeking clarity in these early stages of your application process, that you're wanting to understand who is a carer, who is a support worker, who is a healthcare assistant, and who is a senior carer. So this video, thanks to your input, whilst it was due to come out, you have in many ways facilitated its release. So I'll start with the senior carer to clarify who is a senior carer and what the roles and responsibilities are that come with this role. So in the health and social care industry, the role of the senior health carer is so vital. It is actually central to most of the activities, in that a senior carer is the one that takes the role of leadership, that initiates many of the requirements that need to be carried out as far as care is concerned. They also senior carers also coordinate the care to ensure greater delivery and smooth and seamless delivery of care to those in their care. So as a senior carer, you will be mostly in the position of leadership. I also need to add at this point that this is not a fairly new role to be recruited for by the UK government. For quite some time, senior carers could come to the UK on a health and care worker visa long before this new initiative or this new drive that we speak about for healthcare assistants. So in many ways, it is not really a new thing for the senior carers to be recruited via this route. They have been on the skills shortage list for quite some time now. With the preservation of the client's dignity and safety and ensuring the client's safety, the importance of a senior carer having their wits about cannot be overemphasized. Given the leadership role that one has to assume as a senior carer, it goes without saying that communication becomes so vital. You need to be that person that possesses those leadership qualities, such as communication, decision-making, conflict resolution, management of diversity, because under your care, you will have these junior healthcare assistants to whom you will have to be responsible, or they will be at least accountable to you, and you will then be accountable to the registered nurse or to the person more senior than you within the care home setting. So in many ways, you are tasked with a lot of responsibilities compared to a healthcare assistant, compared to someone that comes in as a healthcare assistant. They will be slightly more junior to you, and this goes for the pay rates as well. Senior carers will be at will get paid at a slightly higher rate than the healthcare assistant. Now, the question becomes, who can apply as a senior carer? It is that person that has got a diploma in nursing, and not to be alarmed why a nurse should apply for a carer's role. These are the nurses who very often have passed their CBT and have passed their IELTS. However, they've not met the required standard of a minimum of a score of 7 for their IELTS. You'll find that these are the nurses sitting with a score of 6.5 with the hope that they will improve their mark, their overall mark was they're in the UK, or their OET results do not meet that minimum requirement. Many recruiters are also expecting you as the registered nurse to have a minimum experience of 2 years before you can apply as a senior carer, because your insights, your initiative, your proactiveness is going to be guided by your experience as well. You cannot be that person that comes with minimal experience and take charge of a team within a team. So it's very important for you to have intuition, to be guided by your intuition, your experience, and just your gut feeling in some of the instances. So that minimum experience of 2 years becomes necessary for many recruiters, not all, but many. So you've passed your IELTS, you've passed your OET, but you've not met the NMC standard. You have 2 years minimum experience, as well as being a registered nurse already. The other thing I'm coming across, the more I'm speaking more and more to employers, including another criteria for a senior carer, is gaps in employment. Many employers tend to frown upon a gap of more than 24 months in your experience. So some gaps are understandable, they're explainable. If you could, perhaps you have a 2-year maternity leave, or you went on maternity leave and became unwell and you've had the 2-year gap within your employment, or for whatever reason, perhaps you took a career break, make sure you clear that you make that come through in your CV very clearly before people start asking questions. Explain any gaps. I digress a bit, but this is a necessary part to say. It's almost as if I'm making a video about CVs, but nonetheless, you get the point. When it comes to the part where you are drafting your CV, do remember to include why you have any gaps in your employment history, in your experience. Even if they're less than 24 months, just go out of your way to explain why there are gaps. The other question I'm coming across quite a lot, especially from the South African viewers, is what happens then if you are an enrolled nurse? This is a very unique position, if you want to call it that, rank, if I were to be precise, within the South African nursing structure, where we have the registered nurse, we have the enrolled nurse, and we have the auxiliary enrolled nurse. So this is just a middle role that is not very clearly defined in many countries, and questions I'm being asked questions as to whether, if you are at what we call back home a staff nurse or an enrolled nurse, whether you could apply for the senior role. This is a senior carer's role. This is something I'm still seeking clarity on from recruiters, and I hope to get back to you with a more precise answer. And if you're able to speak to any of the recruiters I have employed you or I have advised you to contact on my other videos, kindly let me know what their feedback is. There is one that is very South African based by origin, but are now based in the UK, so they will understand exactly what I'm talking about when I ask about the nursing, the enrolledness role, whether they can apply as senior carers. So I hope to speak to them after the Easters, and hopefully I will get back to you with a more concise answer as to whether you need to apply. Definitely as a healthcare assistant, you will be accepted, but as a senior carer, I'm not very clear about that at this point, but it's something I can just make a short video on once I know. And if you do find out before me, do kindly let me know what your feedback has been. I have spoken at length about the vital role that is played by healthcare assistants and just how important they are as part of the bigger picture. I have attached the video, but healthcare assistants remain a very integral part of any healthcare team. They work alongside nurses, alongside senior carers, alongside doctors within different healthcare settings. It's sometimes in nursing homes, it is within hospitals, within GP surgeries. It could be anywhere that you come across a healthcare assistant, and this role of people perform very important duties and play a vital role that cannot be replaced. And hence, the addition to the skills shortage list. Previously, healthcare assistants were not recruited from overseas. This is unheard of for many years. It's unprecedented, as I said. So it's a category that is quite vital and essential within any healthcare team. The roles and responsibilities is something I can cover on a different video in the interest of not making this video too long. Now comes the terminology that is bringing about the confusion. Terminology such as support worker, healthcare assistant, carer. Which am I? Which one am I applying for? So more or less, these are the same. It just largely depends on the context, the area within which you're working. Mostly when you're working within a hospital setting or a care home setting, it's unlikely that you will be referred to as a support worker. Whereas when you are in a community setting, as it mostly is the case with many of the jobs in the UK, the same healthcare assistant, shall I say, can be within a community setting supporting a person living within their home. And they will be referred to as a support worker, or within a domiciliary environment where you live with a family or you live with your client and support your client. You are most likely going to be referred to as a support worker. So whilst each one might require slightly different experience, different qualifications, generally they overlap and they are so similar. So there's just a whole gray area where they kind of overlap one over the other. So all I can say to you is do not overly concern yourself. Just understand the difference, at least between these roles of healthcare assistant, support worker, carer. Those can easily, just for your own peace of mind, especially being out of the country and not having seen these roles in person, it's best that you understand them as one thing and understand the senior carer as a slightly senior role compared to this particular role. And as we said, the senior carer will expect you to have slightly more experience. Some people will even be nurses. Some people will have degrees of different professions. But as a healthcare assistant, requirements might be slightly less for you. You might be expected to have healthcare experience, healthcare background, some experience of some sort, as I've said in my other videos. And as you know, I have posted jobs where no experience was necessary because you were going to be taught on the job. There's just the basics such as English literacy, English proficiency that you were expected to be in possession of. So I hope this clears it for you. Just remember that there is a senior care role and there are these three care roles. They don't in any way make you junior or make you inferior. It's a vital role that is needed, that is required, without which a lot of the things cannot be achieved within the healthcare setting or the care home setting. So yes, continue in your quest of seeking a job. Just apply for the right one. Don't shortchange yourself by applying for a senior carer's role if you don't think you meet the criteria I told you about earlier. Not everyone requires that criteria, but it was just one of the many ones that I've come across that that particular recruiter was looking for those qualifications for senior carers. I hope this video will help you have better clarity in seeking your job, in finding your job. There are so many. Do not give up. I keep saying this is a new process. It started on the 15th of February. It's still early days. Don't let anyone lead you to believe all these roles have been fulfilled or if somebody has stopped recruiting. The jobs are out there. They still need to be fulfilled. It could be that, as I keep saying, there will be bottlenecks in the system. It's still fairly new to everyone. So continue in your quest, continue to seek experience, continue to do those free online courses to which I have attached the video again, one of my videos again for you to watch and familiarize yourself as to how can you optimize your chances of coming over to the UK. And lastly, if you were ever in doubt of whether you could or could not apply for this position, I have attached a video here that tells you who can apply for this position. And I hope this video will answer your questions and make you hopefully realize that you too can apply for this opportunity and hopefully change your life for the better. Thank you so much for staying tuned. Remain on the cusp with Daphne. Thank you for watching.
No one can do it like you.